right, we are going to do an insertion and removal of a sterile catheter. We have Joanne Jones. Dr. Jeff has ordered for her to have a catheter. I checked the I checked the doctor's orders, and then I've checked my 7 rights. So her 7 rights. Okay. I would check again outside of the room. Knock, knock, knock. Hi, Joanne. How are you today?
Hi, I'm good. How are you?
Good. My name's Sheena, and I'm your student nurse today. Dr. Jeff has ordered a catheter insertion. Were you aware?
Oh, yes, ma'am.
Okay. I would do hand hygiene. Put on gloves. Joanne, can you verify your name and date of birth for me, please?
Yes, ma'am. Joanne Jones, 12/3/67.
Okay, I'm just going to check your armband here. Joanne Jones, 12/3/1967. And Joanne, are you allergic to anything other than penicillin, such as silicone or iodine?
No, ma'am. Just
No.
penicillin.
Okay. And Joanne, on a scale from 0 to 10, 0 being no pain at all, and 10 being the worst pain that you've ever felt, can you tell me your pain?
Oh, 0 pain, Miss Sheena.
Thank you. Now, Joanne, I have to lay you flat for this procedure. And we do have to bury you for a little bit. The curtain is pulled for your privacy, so no one can see anything.
Okay, perfect.
All right. Okay, so I have an extra sterile catheter needed. I have an extra set of sterile gloves if I break sterile field. I'm going to set my urine specimen cup over here because I need to grab that after. Okay. I'm going to set just the rest of my supplies out of the way. I have lube. Comes in the package, but because Joanne can't take regular lube, we're going to set it aside. So, set this aside and this aside for just in case. Put that there. Okay. Now, Joanne, I'm going to put a bath blanket over you, and if I can have you hold the top,
Okay.
we're going to take your sheet down, okay?
Okay.
All right, thank you. Now, Joanne, I'm going to need you to go into what they call the frog position, where you're kind of spread eagle here, all right? We're going to put a barrier underneath your bum so your bedding doesn't get all wet.
Okay.
So I'm going to help you here with residents. Patients, we would ask that they lift their butt for us if they're able. Otherwise, we would just roll back and forth and get this chuck underneath and then open them as far as they were able to. I'm going to cover you up. I would do pericare as needed for any incontinence. Okay. So I have my sterile gloves here. I have ensured that my sterile catheter is non-expired. It's 14 French, 5 milliliters of sterile water going in. I have ensured that my sterile gloves are not expired as well. Okay, so what we're gonna do, I would have changed my gloves after any pericare if it was needed and then putting the chuck underneath. I'm going to take this out. You can open this up and use it as a garbage if you need to. End of the bed. I have a garbage over here, but just in case. So you would take that and you'd throw it away. All right. Set that here. Okay. So I'm going to remove these gloves, perform hand hygiene, and now I'm going to open up my sterile catheter set. Only touching the outer 1 inch, furthest away, close, and she doesn't want to open for me. turn so I'm not reaching across and contaminating any of the sterile field. These are sterile gloves that come with. I'm going to use these ones instead. Okay. I'm going to take this pad right here, which is going to go under Joanne, and we are going to do glossy side down. So we're going to tuck it. Joanne, will you lift your bottom for me so I can just push this underneath? Perfect. You are. Great. Okay, now I'm going to open up my sterile gloves here. Take these out, toss in the garbage. Right and left. I would try to have a bigger workplace here. I'm going to start with my dominant hand putting my glove on. So I'm going to grab the outside here. I'm not going to lower my hand below my sterile field. Perfect. Now I'm going to go under here. Put it in there. We're not gonna break sterile field here. We're going to put this glove on. I'm going to grab under here and pull up. Perfect. Okay, because this is sterile, I am just going to throw it away in the garbage. I'm not going to use this protector, so I'm just going to put it in the garbage. Okay, because this is sterile, an inch border, I'm going to separate. I have my swabs for cleaning. I have my 5 milliliters of water. What I would normally do here is take the lube and put it right in the top here. And then that would hold the catheter tip in there. But we're not going to use this, so we're going to set it there. This is for my urine specimen. Put that here. I am going to take and put my water on here. And set that in here. I can take this off. This is all sterile. And I would throw it in the garbage. And I would stick this in the lube like so. Okay. I can put my items back on here that I'm going to use. I would ask my assistant to uncover Joanne. Thank you. Keep the sterility here. Perfect, and then she's going to put lube on the end there. Perfect. Okay, Joanne, I'm going to put some iodine on the outside of your labial folds, and then I'm going to work my way outside, outside, in. So, I have my 3 here. I'm going to do one at a time. This hand is no longer going to be sterile because I'm touching Joanne. I'm going to go outside down, and I'm going to toss it in the garbage. I'm going to do inside down, toss it in the garbage, and then I'm going to do straight down the middle and toss it in the garbage. And that as well. Okay, Joanne, when we start this, I'm going to need you to bear down, take a deep breath, so we can get this inserted properly. Are you ready?
Yes, ma'am.
Okay, 1, 2, 3. I would go in until I feel a little bit of resistance, and then once I see urine coming back through is when I would push it in another inch or 2. So we've gone in. I would take and add my 5 milliliters of water. Perfect. Okay. We have her set, Joanne. We're going to take this off. And then with our 5 milliliters of water, as it is in, it's no longer a sterile field. So I can take these gloves off. I am going to put different gloves on. After this, I would get a leg strap, have it connected to Joanne, leave a little bit of room there. I would package all this up, throw it away. I would have this hanging at the end of the bed. There. Just going to move all of this for now. I would label when we put the catheter on and who did it. So it's strapped to the leg, it's at the end of the bed. I am able to put Joanne's head up. For video purposes though, we are going to take the catheter out, and before that we are going to get a urine specimen. So as we have the urine specimen, I'm going to take my cup here. Because this is a new catheter, I am able to just go ahead and take the lid off. I am able to put a barrier down, and I am able to empty right into the cup as it's new. If it was not a new catheter, I would take this, I would clean it with an alcohol pad. I would take a needle, a syringe, which I know I have, and I would insert it in here, and I would pull any urine out that's in the line. If there is no urine in the line, I would clamp it. Let urine go through. I would clamp it to stop the airflow with these, and then I would try to take it out as well. Okay, I would insert it in here. I would label it appropriately, name, date of birth, time it was taken, who it was taken by, order. I would bring it to the lab. Now for removal, I would have made the patient comfortable. Came in, done my 7 rays, tell my patient that they need to have their catheter taken out. Verified name, date of birth. We are going to take it out. So hand hygiene, change gloves. And Joanne, we are going to get you into a frog position again.
Okay.
We're going to take out your catheter. So we are supposed to clamp the catheter so as not to pull it out and urine goes everywhere. Put a chuck underneath her. I'm going to ask you to take a deep breath. Whoop. I'm not going to do any of that yet because I need to take the water out of my apologies. I need to drain. I would have wiped it with a alcohol swab. I would take the 5 milliliters out. Perfect. I would have checked the order in the MAR to ensure that it was 5 milliliters and not more. So now I would clamp. Ask Joanne to take a deep breath. And I am going to pull. Ready, Joanne?
Yes, ma'am.
1, 2, 3. And there we go. I would clean her up as needed. I'm going to take all of this. I'm going to take the check. Throw all of my stuff away, sterilize anything that is needed. Take my gloves off, make Joanne comfortable, prepare hand hygiene. Put the blanket back over her. And the bath blanket. What a perform hand hygiene prior to touching the bed. And then I go back and document. Document that it was inserted and document that it was taken out as well. Remove any of the garbage as necessary.